Child abuse and neglect. So this is what we're going to talk about today. I just want to start off with some definitions. Child abuse is considered any abuse or neglect of a person under the age of 18 by a parent or caregiver. This can also include any adult who's responsible for the child at the time, such as a coach or a teacher. Physical abuse is any physical action or force towards the child that results or could result in physical injury. This could include kicking, punching, biting, slapping, or shaking. An example of physical abuse is shaken baby syndrome, where the caregiver becomes so frustrated that they shake the baby aggressively, which can cause death or severe harm. Emotional abuse is behaviors from an adult that cause psychological damage, emotional distress, and decrease the self-worth of the child. This could include shaming, manipulation, emotional neglect, and name-calling. Sexual abuse is any intention or completion of sexual acts by a caregiver towards a child. This could include penetration, exposure, and fondling. And neglect is where the caregiver does not meet the child's physical and emotional needs. This could include failure to provide food, housing, medical care, failure to provide, meet their emotional needs, and failure to provide a good education. Question number 1, what are some examples of physical, emotional, or sexual abuse? Some statistics: about 1 in 7 children in the U.S. has experienced abuse or neglect within the past year. This is a breakdown of the main types of child abuse. 78% contributed to neglect type of child abuse, 18% has been physical abuse, and 9% has been sexual abuse. In 2021, 1,820 children in the United States died from child abuse or neglect. And victims of child abuse are often at greater risk for chronic health issues later in life, such as mental illness, hypertension, obesity. Vulnerable child population. So being a child in itself makes you part of a vulnerable population. To narrow it down, American Indian and Alaska Native children have the highest rates of child abuse at 4.3 per 1,000 children, and African American children are among the second highest to experience abuse, which is 12.1 per 1,000 children. Developmentally disabled children are at higher risk for abuse, and child with medical conditions, especially if they need greater medical needs such as neurological, or if they have neurological or gastrointestinal conditions that require higher medical care, they're more at risk for abuse. So risk factors for the child or the victim: if the child is younger than 4, it puts them at greater risk, and children, again, with comorbidities such as mental illness, chronic physical illness, and disabilities where they might require more attention, they are greater risk for child abuse. Risk factors for committing child abuse: on the individual level, substance use and mental illness can play a role in increasing their risk of committing abuse. Those who are abused as a child, low socioeconomic status, and relationship and family risk factors. Families that are isolated, so families that may live far away from the rest of their family, where they don't have any support, that puts them at greater risk. Relationships where abuse is involved, like domestic violence, if there's partner abuse. Low socioeconomic households, and poor communication styles within the family. On the community level, places with higher crime and violence rates have higher risk for committing child abuse. Low educational opportunities, high unemployment rates, food deserts where there might not be good, healthy food options, places with inadequate housing, whether they don't have enough affordable housing. Massachusetts has a good amount of affordable housing, however, it can be really hard to get it. Priorities for the family nurse practitioner: ensure the child is safe. This is going to be your number one priority over everything else. If you suspect that the child is not safe to go home, you want to immediately contact law enforcement, or if the child comes in a really critical situation, you go back to the ABCs and prioritize keeping them alive. You want to identify early warning signs of abuse. Sometimes caregivers can hide abuse well, and you just want to make sure you're really thorough in your assessment, so if you catch anything, you can address it. Know when and how to intervene when the child abuse is suspected. Like I said earlier, you want to contact Child Protective Services or law enforcement immediately. All healthcare providers are mandatory reporters, so it's your duty to report any suspected child abuse to Child Protective Services again. CPS is a unit that helps investigate child abuse, and then DCF is the broader organization that can help, that CPS is under, and DCF also helps organize the steps moving forward if child abuse is present. Signs and symptoms of child abuse. Some obvious ones are bruises, fractures, abrasions, or burns. An injury that may not add up to what the caregiver is telling you, like if they have a black eye and then they said they fell out of bed, but the black eye looks like they were punched, it's probably not because they fell out of bed. Injuries in a child that does not walk. For example, if a 3-month-old has a fractured femur, how did they get that? They definitely didn't get it from walking. Multiple hospital admissions due to unmet medical needs. For example, if a child has diabetes and they keep becoming admitted because they're in DKA, then the caregiver definitely is not managing their diabetes appropriately, and this is also, this would be neglect. Different injuries in different healing stages, so you might see one pretty fresh looking bruise and then a bruise that looks a little lighter, or an abrasion that looks fresh and then an abrasion that's healing. Neglect is very common. It's the most common type of child abuse. Signs of this would be malnutrition, if you saw muscle wasting or if their electrolytes weren't correct, poor hygiene, like poor dental health, and clothes that do not fit right or clothes that do not meet the season, like if it's freezing outside and the child just has a t-shirt and shorts on, that is an example of neglect. And you want to look for behavioral cues from the child, like being withdrawn or fearful, and rule that out and make sure there's no abuse at home. Question number 2, what is the priority of the FMP when child abuse is suspected? Interventions when child abuse is suspected. The priority, like I said earlier, is always the child's safety. You want to get CPS or law enforcement involved right away. On the longer span of things, you want to involve other team members of the interdisciplinary team, such as child abuse specialists, case management, social work, and therapists. You want to provide a safe space and emotional support for the child. You want to make sure that they feel comfortable going to you if something's going on at home. Assess the child for conditions such as PTSD and depression, and educate families on how victims of abuse may need extra support in areas such as mental health. Question number 3, what can the FNP do to create a trusting relationship with the victim of child abuse? And this is just some resources for the FNP. If child abuse is suspected, this is a child at risk hotline that you can call, or it's always easier to just call law enforcement. And then here is some assessment tools for the suspected child abuse. The escape screening tool is a fast 6-question form that's good for emergency departments. And the child trauma questionnaire does a thorough examination looking for physical, emotional, or sexual abuse or neglect signs. This is good for the primary care office. Here's my references.